again for taking some time with me this morning. I can see in your background there, are you at the Javits Center?
Yeah.
Are. So, just tell me about your experience right now, kind of truly being on the front lines of this pandemic.
Well, I'm a neurosurgeon, so COVID has very little to do with my kind of professional training, especially I'm like over 20 years out from my residency, and so I haven't really taken care of pulmonary and critical care patients primarily for a long time. In neurosurgery, we do a fair amount of sick patients, so we're used to some of the physiology and some of the medications and the issues that have to do with critically ill patients, but the unique aspects of these types of pulmonary issues are, unique to COVID for sure. For the first 3 weeks, I haven't done a neurosurgical operation in about a month. We've really shut down all of our elective surgery, and for some reason, even most of the emergent surgery is kind of evaporated.
Right.
I would imagine patients are going elsewhere. They don't want to come to the New York hospitals, if I was them, I wouldn't want to either.
Sure.
So we made an early decision in our department to redeploy into the units, both to learn about the disease in case we were needed if the volume load and continue to increase that we could potentially perform as intensive care doctors. And secondarily, we were providing, the neurosurgeons were acting as a conduit between the intensive care and staff and the families. It's been very difficult with all these sick patients, to take care of the patients and, keep the families abreast of what's going on. So I thought that would be a good role for us to play. Number one, we'd learn about the disease, we'd learn about the patients, and then since we're used to talking to families about people who are ill, it would be a good role for us to play. And so I did that for about 3 weeks. We actually have a mobile app that we have developed to communicate with families either asynchronously or synchronously, like movies and video and this kind of thing.
Mm-hmm.
So we've been sort of rolling that out at the same time. So the last 3-4 weeks have been pretty edifying. I've learned an awful lot of new critical care. I know a lot about ventilators and PDEF ratios and all the stuff that I kind of forgot. And then over the past week or so, our health system had asked for volunteers to come over to Javits, and I really wasn't going to do it originally. I didn't think it was really my role. I'm a chairman of a department, and I felt that I got a lot of stuff going on a daily basis back in my regular job. But I just, after a while, thought that we probably won't be needed as intensivists. In fact, the volumes are starting to come down, and Javits does need intensive care doctors to help. And I also was hoping to improve their communication issues with their families, although this is a much bigger kettle of fish here. So this is actually my first day working in the unit here. It's not that many patients, it's not nearly as bad as it was at Lenox.
Okay.
But it's great to see the Army doctors and the military physicians, and it's just that the culture's great. It's just so surreal, the whole thing.
It is. It is. Well, again, I can speak for everybody, and I know our audience. Thank you for your service, and like you said, I think this is requiring people to really step out of their comfort zone. And like you said for yourself, it's been years, since you've intubated a patient or anything like that. So really, it's people have really stepped up, and it's what's required right now, which is amazing that it's happening.
What ends up happening is there's just a lot of niches to fill. There's not an exact particular place to go, so you have to adjust and you sort of know what your skill set is, and then you have to say, oh, I think I could try doing that. No one's telling us what to do. Right. For a while it was utter chaos, to be honest. And remember, they just built this hospital at Javits over the course of 10 days, so they're learning. They had to install an EMR and labs, and you can imagine then I think originally they were only intending to have non-COVID patients here, and then it sort of switched because there weren't any non-COVID patients to take care of. Right. So in general, I think it's a lesson on leadership and on being innovative, being opportunistic, being collaborative, leaving your ego at the door, kind of thing.
For sure.
Good lessons of life.